results tend to vary on each person. Because we do a phase 1, phase 2, and like a maintenance plan, the first phase is meant to actually remove a lot of the compensations that you typically have. So depending on how much compensation you have, how much autonomic dysfunction you have, it'll vary on each person. But I would say on average, the first 2 weeks, people don't really see too much gains just because the brain's trying to take in all this new information and whatnot. But after that, going into week 3, week 4, typically by the end of phase 1, which is 6 to 8 weeks worth of time, is when you'll typically see your initial results that you're wanting to see on your own. Now, we're seeing the results way before then, but for you to feel those changes, I'd say on average 6 to 8 weeks. But on the other hand, we've had people within the first week. We've had people in the third week. So it's not limited just to 6 to 8 weeks. Just on average, the person takes a little bit longer just because there's a lot of distress that's going on to the body that needs to be addressed. Our success rate is really high at Parr PT. Now, when I say success rate, it's, a lot of this is objective, right? Or objective and subjective. So based on what the person is telling us, as well as our functional outcomes that we have specific to our practice to show, hey, you've improved this percentage. So because we rely on our programs and what we do with our hands, it does affect the results, whether or not you're doing the program or not. So someone who is fairly consistent with our programs will, on average, I believe it's about 93% success rate, which is pretty high given the, over the 1,000 patients that we've really totaled in. Whereas people, let's say they were less than 50% compliant, so they're only doing it twice a week, we only saw about like a 43% success rate. So the programs are there, the treatments are there to be used together, not apart or separate. So when you're thinking about embarking on a program, you have to see if you're actually ready to do both at the same time. Because I know, everyone's season is different, but understanding if you're not combining both, the results will be a lot lower percentage. It is very possible to have 100% symptom relief. Because the body is so plastic and it just absorbs so much information, you could have something that may have been lingering for 5 years, but it could have been something so small mechanically that needed to be addressed that within the first few treatments, you get all your pain relieved. We've had people that initially they were athletes and then they, had some sort of autonomic dysfunction, a flare-up where they weren't able to tolerate much activity. And then within the first 6 weeks of phase 1, they were actually good to go. So it does vary. It is possible, but then we also have to be realistic that every person that comes in typically has one diagnosis, right? But they also have 2 to 3 other secondary diagnoses that make it hard just to go 100%. So our goal at Parr PT is like our 100% is really trying to get you at 80% of what you were before. We've been researching our results over the course of the last 5 years. And what we found is that, for an example, if someone starts at rock bottom, feeling really bad, pain, autonomic dysfunction, whatever might be going on, the likelihood of, once they complete the program, phase 1, phase 2, and their maintenance, if they were to have a flare-up, we've never had anyone go back to the very beginning of where they started as far as what they have from symptoms. Typically, you go back about 50% if it's something that's some sort of major flare-up, but you never really go back to what you were before. Now, I say this to everyone, like, wellness is a lifestyle. It's not something you can just stop. So having done the program and maintaining it is important to maintain the results long-term, but just know even if you fall off a little bit, it's not going to be so detrimental that you're going back to square one. So your body has a better fundamental, it has a better foundation of how your body perceives new information to where it's much stronger than it was before, so you're less likely to have those flare-ups. I would say our 3 systems approach is more effective than what we've seen out there specific to chronic illnesses, is that we do consider a lot of different systems that most clinicians or most providers don't take into consideration, which is essentially your vestibular system, your autonomic nervous system, and your GI system, in addition to understanding how that correlates with movement, how that correlates with compensation. And the fact that we can start at a very low level, slow progressive approach allows us to really tailor it to every single person. We're not using protocols. And I know I say that a lot, but I feel like that's the reason why we're so effective is we're not tailoring one protocol to every single person. At Parr PT, we do physical therapy for Chiari malformations and syrinx patients. And that being said, I know that there's different grades of Chiari malformation, whether you're grade 1, 2, or 3. We've seen them all. We've seen them as big as 20 millimeters all the way down to maybe 1 or 2 millimeters. There's specific precautions that we take, both from a hands-on standpoint as well as from a movement. But with those conditions, it's really important that you apply movement because stability is such a key role in maintaining good body function, whether it's activity tolerance, things that you're doing on a day-to-day basis, because of where that cord compression might be, and where everything is sitting within the canal. So same thing for syrinx, like understanding where its placement is, and having that knowledge that we have allows us to not so much be aggressive, but still get very effective results without compromising the areas that are, compromised from a structural standpoint.